Hey, it's time. How is everyone? As Linz has pointed out, she and I are hopping around across the globe. And so just kind of coming to you separately for a couple of weeks. I'm going to keep this one pretty short and sweet. And what I really wanted to do was to take a couple minutes. There is a lot of noise in the media and on social media about the word doctor and what that means. And so I think, as always, Lindsley and I try to provide you guys with science-backed information so that you can be a better consumer of information and make the decisions that are right for you, for your family, for your loved ones, etc. And so I just wanted to talk a little bit about the word doctor and what that actually means alone. And as more and more doctors are on social media, are hosting podcasts, are doing all of these things, it's important that we understand who we're listening to so we can then evaluate the information that's best for us. So again, I don't want to comment either way on things. I just want to provide some information. So doctor applies to anyone that has completed the appropriate educational requirements to be considered a doctor. So this can be a chiropractor. This can be a PhD in any field. So there are often nurses who have completed their PhD who can go by the title of doctor. It can be a dentist, orthodontist. It can be a doctor that you see for your primary care. It can be your surgeon, etc. So as long as you've completed the educational requirements and graduated, you can use the word doctor. So it also applies to doctors who've gone to naturopathic school. So it's a pretty broad term. So when you listen to a podcast and the host or the guest introduces themselves as doctor, it can mean a lot of different things. There's no judgment on the qualifications, but just to let you know, it can mean a lot of different things. So then there's been a lot of attention on what does it mean to have a medical license. So a medical license gives you legal authority to practice medicine in the state in which you're obtaining a license. You have to get a different license in every state, and there's different requirements per state. To be eligible for a medical license, you have had to complete medical school, either an MD or a DO, and you have had to complete 1 year of residency, which is usually called internship, and then passed the beginning of your licensing exam. So either it's the USMLE if you're an MD or the COMLEX USA if you're a DO. And there are some different requirements if you're a foreign medical grad, but it requires a background check, some references, and a disclosure if you've ever had any malpractice suits. So pretty much MDs that have gone to an allopathic medical school, which is kind of what people are usually most familiar with, after they complete their intern year, they can apply for the medical license in the state in which they're training. So to continue to have a medical license, there are requirements for continuous medical education, and then there's state-specific requirements focused on competency and safety that are different per state. You can hold medical licenses in multiple different states. There are things called compact medical license, which allows you to apply for one license that covers a few states. And so again, you have to renew it usually every couple of years, but this does not really grant you procedural privileges in a hospital, et cetera. It's a state mandated licensure to practice medicine, and it's a legal mandate to be able to practice medicine that you have to have a license. So then let's go to the next piece, which is board certification. And this again, this conversation, I just want to say for now, I've narrowed the term doctor to more of what we consider in the traditional sense doctor. So someone that is going to practice medicine. So this doesn't apply to PhDs, dentists, orthodontists, chiropractors, naturopaths have different requirements. But for doctors that you most traditionally see in a clinic or a hospital setting, then what comes is board certification. Board certification means that you have completed a residency and applied to take the board exam in that specialty. So, for example, myself as an anesthesiologist, it meant I had completed my anesthesia residency and I was eligible at that point because I had finished my residency in good standard to sit for the anesthesia boards. They're usually covered by a governing body. So, for example, the American Board of Anesthesiology. There are also osteopathic boards for people that have a DO, degree, but DOs can also sit for any any board certification in which they've completed a residency as well. So there's no real difference at that point because everybody's gone through the same training in residency. You don't have to be board certified legally to practice medicine, right? You have to have a medical license, meaning you've done at least 1 year of residency. But legally, you do not have to be board certified to practice medicine. So legally, you don't have to complete a residency to practice medicine. However, most hospitals, if you are affiliated with a hospital, and even to obtain some types of insurance, you have to be either board eligible, which means you might be in the process of taking your boards, you've completed residency. Many young physicians out of residency get hired in a board eligible state because it takes time to take your boards, or you're board certified. To maintain board certification, you have to participate in maintenance of ongoing certification, which are programs led by these national governing bodies for education, retraining, reevaluation as needed. And they're all a little bit different. So again, usually, this is not 100%, to be a quote unquote doctor in a hospital, you have to be board certified or board eligible, which means you've completed residency training. You also need that for most academic appointments, require you to be board certified. Many practices, if you're hired into a practice, say your local group of pediatricians or internal medicine, they often require board certification as well. And then let's talk about hospital credentialing. So that's kind of the third step that can come in. So hospital credentialing means that the hospital has evaluated you as an incoming physician and credentialed you, meaning has allowed you privileges to practice at that hospital. So for example, you would go, if I was going to go work at hospital X, I would apply for credentialing at that hospital. This usually requires an active medical license in good standing, board certification in the specialty that you're trying to practice at that hospital. Requires you to be registered with the DEA, which is the Drug Enforcement Agency, which allows you to write certain prescriptions. It requires verification, and even though this seems duplicative, and it is, requires verification that you have completed your residency or your fellowship, which is additional training after residency, in good standing. Even though you usually need that to be board certified, they check both things. It reviews your malpractice. It looks at your case history, meaning how many times have you done this? Are you qualified to do what you're asking to do? And then it also usually requires peer references and then ongoing practice evaluation. And then this is institution specific. And when you go to get credentialed by a hospital, you also apply for the privileges you would like to have. So for an example, if you're an OBGYN and you want to be able to deliver babies, you apply for those privileges. If you're a surgeon, you apply for certain privileges. And so it differs between specialty, what privileges you have. So to back up and go through this again, doctor means a lot of things, right? You can be a veterinarian, you can be a PhD, which also people are very entitled to use the word doctor in describing their title. I think where this becomes confusing is when we see in media, people say doctor and what a lot of other people imply. So just know to look, like, what are the credentials behind that doctor? And then if you're really seeking to understand where they're coming from, it might be worth doing a deeper dive. If they have a PhD, what's their PhD in? How does that relate to the information that they're sharing with you? If they're a doctor more like an MD, DO, chiropractor, etc., what are they licensed in? What is their training? And how does that relate with the information that they're sharing with you? And again, there's not a right or wrong. It's just so you can be informed of how their backgrounds match what they're doing. And there's a lot of ongoing training available for doctors. And I think I'm a good example of that. I'm a double board certified anesthesiologist who has taken an interest in women's health and have received multiple other certifications in that area. So you can shift this with ongoing education as you continue on. So it doesn't mean that someone that started out in X field cannot become an expert in field Y even after training. It's very doable. But again, I think as consumers, we need to be savvy and we need to do our due diligence to understand where our information is coming from. I think it's also important to understand the differences when in kind of the oaths and ethics that we take. And as an allopathic physician, we take an oath to do no harm. And we do have the responsibility that we possess the skill set to be able to diagnose and give people a treatment plan. People who have a PhD in the health field don't necessarily have those same things. So they have the ability sometimes to talk about things in a broader range because they don't have to live by those same standards. And there's often disclaimers about that in the fine print of something, written materials, and or at the beginning of a podcast, possibly, etc. So just again, it's something to pay attention to. By all means, all of these people can offer good information, but again, to be a conscientious consumer of information, we need to know where it's coming from and then be able to determine for ourselves if we feel that information is credible and if the source is authentic. So as we continue to move through these topsy-turvy times, and I will tell you, it takes oftentimes a team of different types of doctors to really advance the field of science. We need researchers and PhDs to really do a lot of the basic science work, to do a lot of the research, to study a lot of really hard questions that then can turn into amazing treatments or pathways or medications or solve really hard problems that we see on the clinical side. And so it takes a whole network to actually advance science. But as we have more and more access to platforms and to spread this science and spread information, I just want you all to understand maybe it's worth reading past the initial title to see where that title came from and what that means for that individual that you're choosing to listen to or to read. And so you can then action that information as you see fit. So thanks for your time. Thanks for listening to this. I hope it provides some clarification, and we'll talk to you next time.
Thank you so much for spending your time with us here today. If you liked what you heard and you got some tips on how to live better right now and for the long haul, please help us reach more midlife women. Please share and rate and like this show, and we can't wait to continue the dialogue with you on our next episode. Until then, thank you. It's time.